I'm Tim Malloy with the Palm Beach Civic Association, working in conjunction with the town of Palm Beach, the fire rescue, and the police. It is April the 3rd. It is a Friday. The weekend is upon us. There are 13 known cases of the coronavirus in Palm Beach right now. 2 of our residents have succumbed to it. The town is under a mandatory shelter in place. To be very specific and firm on this, that means don't leave your house, don't leave your apartment. If you need medical supplies, obviously. If you're ill, clearly. If you have to go get food, yes. If you have to go to the vet, yes. Otherwise, can't go in the ocean, can't go on the beach. And if this weekend is anything like last weekend, it'll be problematic, because last weekend was a blatant display of people driving around in convertibles, bicycles, motorcycles, runners everywhere. Completely understandable that people want to be outside, but right now we're in a new era. We are 1 month away from the peak of this in May, so it's just building. So you're being encouraged now to really ratchet back your exercise. Do it, but try not to do it in groups. And everybody, police, fire rescue, the town, hopeful that this weekend is not like last weekend. So we will be talking about that in a minute. We want to talk about masks with Maggie Zeidman, who will be appearing here in a minute or so. But I went around town with a camera and just to take a snapshot of a town that usually at this time of year would be thriving, a town of 8,000 to 9,000 people, and just a quick overview of the quiet that's descended on Palm Beach. It seems there are more American flags on display in Palm Beach these days, as businesses shutter and residents rally together to face the crisis. Restaurants as well, several in town doing what they can to stay solvent by offering takeout. A lot of people taking them up on it. On Worth Avenue, the occasional couple looks in storefront windows. Keeping her distance, a mother pushes a stroller on the nearly abandoned shopping mecca. A couple streams by on bicycles, the only traffic with wheels on Worth Avenue. Each closed store has its own message. One in particular, a personal one. There are emphatic reminders that the beaches are closed everywhere, closed to everyone. No one, not even oceanfront homeowners, can go into the ocean. Those who tested this weekend will be arrested. The Venerable Breakers flags flapping from its towers is empty. This a reminder of the economic impact the crisis will have on our area and all the thousands of people who work there. A 3-week pause for one of the county's largest employers. Take a ride around and you see that social distancing is a personal choice. Building a home is a team effort. The men in this shot, 13 of them, are clearly not at the suggested distance. They can't be. The town, of course, inclined not to shut down builders. For so many, this is a time to live remotely, time to wait it out and stay hopeful, because it will all pass. As if you've been following us, you know Maggie Zeidman, the former chief of nursing at Lenox Hill Hospital in New York City, and a town councilwoman, has reported for us virtually every day since this all began more than a month ago. We're going to do this again today. She's going to talk about the importance of wearing masks, which may be inevitable and should be in practice right now if you're going to be around people, and other things as well. And later on, we will send you to a talk she had with Dr. David Dotson, an expert on infectious disease doctor in our area, well-known, noted doctor, about things we need to know. But first, here's Maggie.
Good afternoon. It's Friday afternoon. The big question today is about masks. Should we be wearing masks, or is it not important to wear masks? So you've heard a lot of confusing things about it. In the beginning, the World Health Organization, the CDC, did not recommend wearing masks. But since we know that up to 25% of the people who are positive with the coronavirus have either no symptoms or have very mild symptoms, and that there may be days between when you become infected and where you actually start to experience symptoms, and you may be shedding the virus. That's why now the thinking is wear the mask. Not for those of us who are not infected, but to protect those of us who are not infected from those who are infected. So if you're infected, you need to wear the mask so that you're not transmitting it to someone else. So none of us know. There's not widespread testing as there had been in some other places in the world. We don't know who's positive and who's not. So we have to assume that everybody is positive. I need to assume I'm positive. So wearing masks is going to become more and more important, and you're going to hear more and more about it. You can go on YouTube, Etsy, Amazon, but YouTube and Etsy has masks. YouTube, they tell you how to make masks, and there's a lot of instructions with regard to making your own mask. You shouldn't be able to see through the material. It should be tightly knitted. It should be double, not just single. I think I went over, you shouldn't be able to see a lot of light through it. So it has to be able to filter out particles. It's not going to do the same job as the N95, but the N95s really are to be used with first responders and medical personnel. They have to be fitted to your face. They do remove, it's called a 95 because it removes 95% of the particles. The masks that we're talking about are not going to do that, but they should be helpful in keeping people who are asymptomatic and who are positive from transmitting the virus. It should be helpful in that regard. The other thing that it might do is to help you keep your hands away from your nose and your mouth. So that's another thing. Of course, the next thing will be eye shields. I don't know what to say about that at this point. The other thing that happened this week is that we have a lot more test collection kits, and there are more tests that are being done. In fact, Daryl Donato told me that there are 91,000 tests that have been done here in Florida. And you know that the governor was here, and we opened up another site. There's another one that's going to open, and there's one for first responders. So we are moving ahead with getting more accurate reflection of the incidence of the coronavirus, who has infected here and where. So all of those things are very important. We know we have community transmission. The governor this week also ordered everybody stay at home, stay safe, shelter in place. All of those things have very similar meanings. It means you're supposed to stay home. So let's talk about grocery shopping then, because I think that's something on everybody's mind. I have paid a few visits to some grocery stores here. I've been to Greens, Amici, and Publix a number of times just to observe, not necessarily inside. The town is putting out instructions for you, which I think are just terrific, where they looked at hours of when it's not that busy in Publix. So I recommend that you go there at times when it's not so busy. Otherwise, it's going to be hard to maintain 6 feet, the social distancing that we've been talking about. So I wanted to just review that with you. It'll be on the COVID-19 alert pushed out by the town. It's very busy there at 8 o'clock in the morning. It's very busy there at lunchtime. It's busy again around 4:30, 5 o'clock. So if you can avoid those times, the other recommendation is you're really supposed to shop for your groceries 2 weeks at a time. And please remember, you can order them online. You don't have to go into anywhere. You can order them from Whole Foods. You can order them from Publix. So, try it out. Amici is doing a great job of creating social distancing. Maurizio is out there himself, and he has arrows going in, arrows going out. He closed the front door. He's doing a terrific job. He has isopropyl alcohol. He's wiping off all the carts. So I wanted to just mention that. The last thing that I want to mention is there are 3 places where we Palm Beachers are getting our news, and they're really our lifeline. So this video is produced by the Civic Association. And so I think that we need to think about that and think about them during this time, to support them in the future. Another is the Palm Beach Daily News. Are you subscribed? You should, because again, that's our lifeline. They cover us. They cover our island. They cover what's important to the people who live here. They have great reporting, and what would we do without them? And number 3, our town manager 3 p.m. updates. They're so full of information, and it just tells you exactly what you can and what you can't do. We get clarification on anything that's a little bit fuzzy, because there are a lot of things coming out that may not be very clear. The pools, construction work, what's essential, what's non-essential. So anyway, I highly suggest that you make sure you're signed into the Town of Palm Beach website so that you can also get those alerts that are pushed out every single day. So it's very important. Okay, signing off for the weekend. It's going to be maybe a busy weekend again, so be very careful. If you want to make a mask, I highly encourage you to do it. Go online, see how to do it. If you're going to be on the lake trail, please observe all of the changes that we've made. It's for your protection. Stay 6 feet away from people. The best thing is don't be around people. It's a terrible thing to say, but unfortunately, that's where we are with this little evildoer virus that we have circulating. So be well, please stay safe, stay healthy, and don't get sick. Thank you.
There's a very important and useful healthcare initiative the Palm Beach Civic Association's Healthcare Committee has put together, and for future problems down the road, including our current crisis. Wendy Rutledge reports on that.
Tim, sometime in the next week or so, current members of the Palm Beach Civic Association will receive these items in the mail. These are a small and large version of a personal medical form that you're going to be able to fill out, and 2 size pouches in which you can place these forms. Now, this is all part of a brand new program that was started by the Healthcare Committee for the Palm Beach Civic Association, specifically led by Chairman Jeff Levitt. And the idea really came to the group from one of its members, Lynn Foster. So please take a listen to these interviews with both of those people as they explain to us the importance of these forms, why they're going to be important to you and your health, and why you should fill them out, and specifically why it's going to be very good for our entire community.
Jeff, what does the Healthcare Committee of the Palm Beach Civic Association do, and what is its purpose?
Wendy, we're a committee of about 20 Palm Beach Civic Association directors and members who meet throughout the year to discuss ways in which we can best address the healthcare needs of all Palm Beach residents. The purpose of the committee was to help Palm Beach residents lead healthier and happier lives. So we end up gathering relevant healthcare information and communicate and educate our community as to the ways in which we can improve the quality of their lives.
What was the healthcare problem that the Lifeline project was addressing, and how did it come to the attention of the Healthcare Committee?
Well, we're very fortunate in that our chiefs, both Donato and Baker, regularly attend the Healthcare Committee meetings, and they let us know that often they didn't have critical medical information about the patient when their EMTs were called in to help residents. And this was because there's electronic medical records everywhere, but they're unable to access that information because it was either at the hospital or the doctor's office or in the record somewhere, but it wasn't available to the EMTs.
Why is the Lifeline solution so important to the Palm Beach Fire Rescue and to the hospital that will be treating a transported patient?
If Fire Rescue had that information in advance when they first see the patient, they could start appropriate medical care immediately on the way to the hospital, and they'd also communicate that information ahead to the hospital while they're en route, so the hospital staff would be ready to receive the patient and jumpstart the care that was required.
And that sounds so important. So what are the benefits to the resident by providing this information?
Well, if our EMTs and hospital personnel are made aware of pertinent medical information in advance about the patient, particularly the current medical conditions or the patient's history and current medications, they'll be in a position to accelerate their care and treatment and probably save time and lives by having access to this information.
Prior medical conditions such as, say, COPD or asthma are going to be truly important if they're making rescues of people with potentially infectious COVID-19. So maybe this is incredibly timely.
Yes, of course, especially now where all healthcare community personnel are under incredible stress and pressure. So being able to have that medical history, including information about cardiac conditions or orthopedic things that are going on with the patient, are very, very important. So yeah, the timing couldn't be better. We're extremely grateful to have Palm Beach Fire Rescue, the chiefs, their staffs, and also I really want to commend our member, Lynn Foster, for learning about this problem and creating a very simple solution to solve it. I think that by having this information available to caregivers is critically important, as is evident from times like we're all going through. So thank you to all of them, and thank you very much, Wendy, for the time today.
Several months ago, you brought in a homemade version that you have been using for years. It was really quite charming, and I believe it involved duct tape. But can you describe your own version of what you made maybe many years ago?
Yes, I'd be happy to. Basically, this project began early this season when Jeff Levitt, chairman of the Healthcare Committee, gathered us all together for a review of what we had accomplished during the past season and to brainstorm about ideas for the coming year. And as you pointed out, during that meeting, I passed around this card-sized piece of paper that I had laminated with my tape gun and created for myself several years ago. And it contains my pertinent medical information, which I update annually. The reason for doing this was for me to have at my fingertips the information that most physicians request of a first-time patient. My card contains such information as the names of my doctors, my insurance, my vaccines, surgical and major illness history, prescription medicines, and emergency contacts. I keep copies of this form with me at all times and have one inside the door of my house and one in my car. It gives me the confidence that should I be in an emergency where I might be frightened, in pain, disoriented, or unconscious, and unable to respond coherently, that this information is readily available to our first responders, giving them this important medical information immediately that may prove critical in an emergency. So during this meeting, when this piece of paper was circulated, Fire Chief and Director of Emergency Management, Dale Donato, and Sean Baker, who's the Fire Rescue Division Chief, both were extremely enthusiastic about this and said that everyone in Palm Beach should do this. So on that endorsement, we launched what we've called this Lifeline project, and is a very small team of healthcare experts, including Jeff Levitt, who has a lifetime of experience running healthcare service businesses, Maggie Zeidman, our incredible town council member and former head of nursing services at Lenox Hill in New York, Judy Goodman, who's an attorney specializing in healthcare strategy and research, and Daryl Donato and Sean Baker. And together we vetted the contents that should appear on this form and prepared to launch it at our annual meeting. I also, during the time, talked with some of our community leaders, such as Paul Leone, CEO of the Breakers, who's very enthusiastic about sharing this form with his 2,200 employees. Well, shortly thereafter, COVID-19 intervened and the urgency of this launch intensified. So we'll be sending to Palm Beach Civic Association members blank forms and plastic sleeves for the completed forms. And we encourage everyone to complete the form and keep one in their wallet or purse, one near their prescription medicines, and a copy in their car. It's an entirely voluntary effort, and any information on the form is purely at a person's own discretion. But we hope that everyone will follow the advice of our first responders and keep this completed form with them at all times. You know, last night we lit up the night in honor of our extraordinary healthcare professionals. And this information will provide them with an additional tool to enhance their ability to deliver even more efficient healthcare to our community during these critical times. So that's sort of a summary of what we're doing, Wendy.
Such a terrific project. What's your vision right now? Members of the Civic Association will receive this. Do you see it going broader at some point?
Absolutely. In the fall, our hope is that we will then be in a position, we'll get feedback from our community of Palm Beach Civic Association members, and we'll tweak the form. And then we will reach out, which I've already started to do, to various members in the community, like the business leaders, the religious leaders, and see what their appetite is for this, so we can get a sense of how they would like to incorporate this into what they do, and then work with them to do a broader launch in the fall.
That sounds great. Lynn, thank you so much for your time and for putting this project together.
Well, thank you. It's very exciting and important.
As mentioned before, Maggie Zeidman did a lengthy talk with Dr. David Dotson on infectious diseases and where we are right now locally with the coronavirus. You can see that on our websites on palmbeachcivic.org. It's rather long and certainly worth looking for and looking at. We're going to leave you now with some pleasant scenes. We wish you well. And at the bottom of this video, you can scroll down and see the entire town overview for this date. A few new things. Please take a listen to Maggie Zeidman and Dr. Dotson on our website. I'm Tim Malloy. Be safe, be well.